Again, welcome to our panelists today. We're going to just jump right in. The way we're going to go about this panel is it's going to start out as kind of a round robin. I'm going to call on our three panelists to answer some of the questions, but my hope is that it's going to turn into more of a conversation. So just keep that in mind as we get going. And I'm going to just start by asking this first question. So, looking back, what has helped you the most in adjusting to life with myeloma as a long-term condition? And I'm going to start, if it's okay with you, Michelle, since you are our panelist that has been living with myeloma the longest. Oops, and it looks like you're muted.
Okay. How's
There we
that?
go. That's perfect.
Okay.
Thank you.
All right. Well, to me, the things that have been most important are just staying hopeful and positive and staying active. And I know that my myeloma specialist has told me over the years that his patients that have done that have done better than patients who, for whatever reason, don't maintain a lifestyle like that. And so I'll have lots more to say, but I'll just start with that. And I do want to mention one other thing, and I'm hoping that today will be that for our participants. I went to one of the, I think it was Multiple Myeloma Research Foundation seminars for families and patients early on, and they were having people raise their hands indicating how many years they had been living with myeloma. And when I saw somebody stand up and he said 24 years, I was like, wow, I can do this. So I'm hoping that my long-term survivorship will be an inspiration to some of you.
I love that. Thank you so much. Pauline, if you want to answer the same question, what's helped you most to adjusting to life with myeloma?
I think one of the things that I think of too is activity. And like Michelle said, wow, you do what you can. If, you're in treatment and it's set a small goal, but to keep active. And when we met earlier and we all had that in common, I thought, yeah, there's something about that. Um, and I think too, don't look too far ahead to the what ifs. Just take it, the good old one day at a time, maybe. But I think that helped me the most. When I was diagnosed, my doctor said, this has become a chronic disease for the most part. So when I think of it that way, um, I can wrap my head around it. People live with diabetes, people live with chronic heart disease. And yeah, it's nothing we want, but okay, I can do this. I can do this. So I think, again, remaining positive. It's hard some days, have a little pity party and then get over it and move on. So,
Absolutely. Thank you so much. Cindy, if you want to share some as well.
Yeah, I'm not sure I have a whole lot to add at this point. I agree fully with Michelle and Pauline that staying active. I think Pauline's point about not looking too far ahead. I've always said it's good to know what's next because myeloma has a way of coming back. I've had four relapses, so I know what that's like. It's always good to know, okay, if it comes back, these are the things that are available today. Um, Obviously, that's changed. I mean, in the 11 years, almost 12 years since I was diagnosed, I think there are 14 new drugs or treatments, which is remarkable. And I've been super fortunate to be on one of those new drugs as a clinical trial and done very, very well with it. But I think, honoring your body, understanding when you're not doing well and you need to rest, which for someone who's always been busy can be a little more challenging. Um, but at the same time, living your life and not, feeling like you have to be in a bubble and you can't go out and enjoy the things that you enjoyed before.
Thank you so much. Was there anything that surprised you? So anything surprising that turned out to be more helpful than you expected in
Mm.
adjusting to life? That one's kind of a little bit different question. Anything that surprised you that was ended up being more helpful?
Mhm.
We had um, grown kids. I don't know if this applies to that, but I had grown kids, and to see them, step up to the plate, to use a baseball metaphor, how they all, took their role. I think it surprised me a little bit. I'm like, oh yeah, they're adults, and we didn't hide anything from them. And,
Yeah,
was it difficult? Sure. But I think that was really comforting,
I like
moving
that.
forward.
Yeah, I think it's hard. I know for myself, just seeing my own children, I still see them as children. They're well into their 20s. And so to see them take those more active roles and, knowing when it's time to check in on you, that's amazing. So thank you. Anyone else with anything that was surprising that
Well,
was helpful?
I think the only thing that was surprising was how much was being done in myeloma and how fast all the advances were coming. It seemed like every time I needed a new treatment, there was a new drug approved. Um, and now there are so many treatments available. Um, it's really a large menu for the doctors and for you to make a choice. And so I've been really, really excited about um, how much the research community has become involved in myeloma research. And that's what's keeping us all alive.
Absolutely. And I think, we look at these treatments, there's always the next one coming. I think the thing that's most exciting to me is just the idea that someday there will be a cure. So, all
Mhm.
these amazing advancements, how wonderful would it be to be in a world where, you know, we don't have to wait for the next and just having that opportunity to be, cured. So I think that's
Right.
wonderful. Thank you guys. So as you've adjusted over the years, obviously during these treatments, they kind of bring their own challenges. That kind of leads into our next questions, which just talks about side effects. So if we just want to go through and let me know just a little bit about your side effects that you may have experienced and what strategies or routines did you find helpful for managing those over the years? I see, Pauline, do you want to go first?
Yeah,
Perfect.
Revlimid, the gut
Mhm.
issues with Revlimid, smaller meals, um, lower fat, burgers and fries, maybe not so much. Um, those kinds of things. Just watched what I ate a little more. I found helped with that. And I also took cholesterol um, along with that at times. So
Perfect. Thank you. Cindy, how about you with any of your experience?
Yeah, so I would I've been on a wide array of things, so dealt with different things. I think a lot of it is being tuned into which drugs are causing which problems and figuring out if you can time them differently. For instance, taking Dex in the mornings as opposed to the evenings so it doesn't affect your sleep as
Mhm.
much. Revlimid at night, people tend to have a little less nausea, at least with it. Um, I some of the other things that aren't necessarily side effects, but increased infection risks and um, kind of managing exposure with while still maintaining an active lifestyle. So definitely had to adapt in terms of you know kind of having my circle around me at least be aware that if you're sick, you don't get to come, you can't come over.
Mhm.
That, yeah, you can't, it's challenging when your immune system is kind of, in my case, sort of permanently compromised. I'm a little more cognizant of being around people who are sick, but that doesn't mean that I don't, go to public places. So I think just being a little more aware and willing to communicate to your circle that, if you've got a cough or a fever or sore throat, please don't come over. And
So,
napping when you need to nap.
absolutely. So, really tuning into your body. Can I just ask a quick follow-up on that? As far as talking to your loved ones about, not being around if they have a cold or something, has that been easy, or have you run into any people, maybe not a family member, but anyone who maybe it felt a little bit more awkward with, and how did you handle that?
Yeah, so I haven't had any challenges with family. Everybody is tuned into it, and they'll be, my grandkids, that are little will, they go to daycare and preschool and that kind of
Mhm.
stuff. Their parents are very tuned into saying, "Oh, so and so has a runny nose. Can we still come over?" Um, with outside people, I kind of, you know, it's really been more of a situation where we've chosen not to go to some things.
Mhm.
Certainly, like this time of year, it can be a little challenging if it's a, holiday gathering that's going to be indoors. And certainly, when it was COVID and things like that, just saying, unfortunately, we can't participate. And, if my feeling is if someone understands, great. And if they don't understand, I don't really care because I have to take care of myself. I mean,
Right.
not to sound callous, but
Yeah.
I think the large majority of people are super understanding.
Absolutely. That's good. That's good to hear. Michelle, how about you? Managing side effects?
Well, I've been lucky in that I haven't had terrible side effects. I did have the same kind of problems that Pauline had with Revlimid, a lot of GI problems, and I also had that problem with Velcade. Um, but I think talking to your doctor is really important, and getting their suggestions for things that can help. And sometimes we actually would reduce the dosage of something to try to minimize or reduce the effects of the some of the side effects. Um, I've had peripheral neuropathy in my feet ever since I was on my first treatment, which was thalidomide, which was the standard of care way back then, years ago. Um, and at one point, it got really bad. It wasn't just in my feet. I had this paresthesia. My face was tingling. Um, and the doctor said, you know what? Let's just try taking you off of it. You've been doing really well. You're basically in a very strong partial remission. And so actually I was on nothing for 2.5 years. And of course, then the neuropathy improved. And then on different drugs, it gets stirred up again, like on Velcade. And the interesting thing was after my stem cell transplant, it went away. Now it came back eventually, but it actually did go away. Um, the neuropathy, I'm on gabapentin and I take a lot of it, but it's tolerable for me, and that does help. Um, I do push myself a little bit. I walk a couple miles a day, and I kind of quit there because my feet start to, get very tingly, and sometimes I'll get shooting pains in them. Um, but to me, the neuropathy is it's just something I live with, and I can still play golf. The only problem I have is if I have to stand on a side hill, I don't feel the ground real well. So I'm real careful about that. But like I said, oh, and the other thing is I get with the neuropathy, my feet get really cold at night. And so I got to the point where I couldn't fall asleep because my feet were so cold. So I take a pair of really warm socks and a blanket and put them in the dryer before I go to bed. take them out, put my warm socks on, and wrap them in a blanket, and I'm fine. I can go to sleep. So that's one of my coping strategies with the neuropathy. Um, that's kind of it.
I like that. So it sounds like all
Yeah.
of you had some communication with your physician if there
Hmm.
needed to be adjustments to medication.
Hmm.
Um, was there anything that you wish you learned earlier about managing side effects? Did you find any particular, um, I don't know, resources or connections that helped you figure out some of the things that could be done?
Um, well, I had attended a couple of different support groups, and that's where I learned some things about dealing with them. I haven't been active in one in a long time. I guess at the beginning it was more helpful than, long term.
I think
Absolutely. Go
also
ahead.
to make sure your doctor knows,
Hmm.
um, don't be a martyr. And it
Right.
might seem insignificant to you, but they don't know what they don't know.
Hmm.
Well,
Exactly.
that's regardless of what the topic is, you have to tell your doctor everything that's going on when you have this, the aches and pains and all those things, because you don't know if your knee starts hurting. Is it because you walked 5 miles the last 3 days, or because you have, myeloma developing in that area? So it's super important, regardless, to communicate to your doctor. And I always encourage people when I'm coaching them and myself to have some type of system, whether it's a notebook or a note on your phone or whatever, where you jot these things down
Hmm.
when you think of them. Because if, depending on the frequency that you see your doctor, you may forget to bring it up, like, oh gosh, yes, I had, a headache
Hmm.
17 days last month, but you'll forget because you don't have one that day when you're in
Hmm.
the office. So it's super
Right.
important to document and share that information with your doctor, because there's often something they can do about it.
Right.
Absolutely.
I actually, I have notes on all my visits with the doctors, and I have those filed in a notebook. And so when something like that does happen, I put a note in there so that next time I go to see him, I'll remember to do that. Um, and I also always have a list of questions printed out for my doctor. And He's really funny. He anticipates them a lot of the time, and then we'll talk for a little bit, and he say, "Okay, give me your list." Um, but I find that's very helpful in remembering to ask about things and communicating with your provider.
That's wonderful. I think I've heard that from several people, just having a written down list of exactly
Hmm.
what's been going on, any questions.
Hmm.
It's hard to think of those on the fly. So I think that's
Hmm.
wonderful.
Right.
So, managing your side effects is such a big part of day-to-day life and often overlaps with the rest of our responsibilities in relationships. So, building on that, we're going to move on to the next question, which is how has living long-term with myeloma impacted your relationships, work, or daily life, and what has helped to navigate those changes? And I'm going to start with Cindy this time, if that's okay.
Sure. So, I mean, this is sort of a multifaceted question in terms of relationships. Um, my family relationships were great and strong before, and I would say they're greater and stronger now than they were. It's been
Hmm.
I'm very blessed to have a super strong family relationship. Um, most friend relationships improve. There's always something, when you have challenges in your life, some people rise and some people kind of don't know what to do. And so there are some changes there, but I would say overall, many more positive changes. In terms of work, I had a big corporate job when I got sick that um, I was off for a little over a year. I tried to go back and went back for a little while part-time, but was unsuccessful in doing that because I was getting sick too often. And it was just, didn't work. Was able for many years to do some part-time work for that company from home. Um, but with daily life, I think we touched on this a little bit before, honoring your body in terms of what you can do and not do, but being intentional about how you go through your life, making sure you stay active, making sure that you eat reasonably well. I wouldn't say, that every meal needs to be, a perfect something, but, making choices that would contribute to your overall well-being, regardless of the diagnosis. Um, and for me, being able to talk about it and have the people in my circle understand, has been very helpful. I'll be honest, I don't talk about it a lot anymore because I've been in remission now for 5.5 years. I only get my treatment every 3 months. So it's really not um, very consuming in my life, and certainly is not at the front of my mind all the time like it was earlier. I don't have the same level of anxiety every time I get a scan or labs because I'm feeling like, gosh, I'm, as close to a cure probably as someone could be right now. Um, so I think just the kind of, it was an adjustment, not working from having been there. I kind of had to learn to be a little slower and a little more in the moment, but I would say that's a really positive thing. And I see a lot of silver lining in the whole process.
Like that. One thing you said there, for anybody who's more newer diagnosed, I like that you highlighted the fact that you have less anxiety around scans. I know in the beginning that's got to be really, really hard. So being able to hear from somebody who has been living with myeloma for a longer period of time, just knowing that that subsides a little bit, I think that's important for people to know. Pauline or Michelle, how about
Yeah,
you?
I think I agree with Cindy. The anxiety gets a little better, and you can share that. We were kind of an open book with family and our very close friends, and I stopped getting the look, when you got around people, uh, because it does go away. People are like, "Oh yeah, how you doing?" It goes back to normal, and I think your relationships do that. I went also from working full time to I quit my job. I put my 2 week notice in the day that I was officially diagnosed. So I was like, oh, well, okay, then I guess I'm not going to get a full time job for a while. So did a complete flip with where I was working. Was working for a hospice and quit that. And then I worked for a hardware store in mixed pink. And it was low stress and lots of nice people. And
Yeah.
so that was a different change, but much needed, much needed.
Right.
I have to say my life wasn't impacted a lot, and I was very fortunate in several regards. First of all, I was able to retire very, very early, because I worked for the federal government, had a certain number of years. They were having buyouts because they wanted to kick people out. Um, so at the time I was diagnosed, I wasn't working. I didn't have a lot of burdens. And I did get a lot of support from my family, my husband most especially. Um, and we talked about everything. Oh, this is an interesting thing. We also had a rule that after 8 o'clock, we don't talk about myeloma at all. And we don't read anything about it. And we don't, and that really helped with reducing the anxiety over going to bed and possibly thinking about it. And, after a while of surviving this and living through relapses and moving on, um, you stop thinking about it. I mean, now it's rare on a day that I think about myeloma, unless I have an appointment, to see the doctor or, something else is going on. But I think the anxiety does reduce. And the other thing I would say is that if you are having anxiety, talk to your doc about it. And there are things, that you can take that help with that. And particularly around sleep, which I would say is one of the most important things. At the time I was taking sleeping pills, the doctor said, keep on taking them. It's really, really important that you get your sleep. So I've done that too. And I think Cindy mentioned earlier, I I set some goals for myself too early on, and that helped me um, reduce the impact on my life because I would be looking forward to those things. I would be looking forward to seeing my grandkids graduate from high school and college and be at weddings, and that really did help me adjust to life with myeloma.
I like that. The one thing I want to go back to, how quickly into being diagnosed with myeloma were you able to establish we don't talk about myeloma after 8? Was that years in or was that pretty quick?
Um, it was some years in. I think maybe a friend had just mentioned about some disease that she had, and that they just developed a rule that you didn't talk about it after 8 o'clock. And I said, "Oh, that's a great idea."
It's
So
beautiful.
I don't even, you know, I always want to know what's going on. So I get into the portal for my labs and scan results, and I want to know those right away before waiting for the doctor to tell me. But again, I won't look at anything after 8 o'clock. Um, so I guess it was probably, maybe 6 or 7 years into having myeloma where we did that.
Like that. Was there anything else, all three of you, that helped maintain or balance a little sense of normalcy? Let's start with early on and then now as you're years in. You remember anything, Doc?
One thing that comes to mind for me is, and Pauline touched on this earlier when she made a comment about periodically you need to have a pity party. And it
Hmm.
ties in a little bit with what Michelle said too about the 8 o'clock boundary, which I love.
Right?
By the way, that's a great
Yeah.
idea. Um, early on, it is extraordinarily overwhelming.
Hmm.
And, in my case, I was very, very sick and in a tremendous amount of pain when I started. So it was all consuming. And when it's all consuming physically, it's all consuming emotionally. And I think that you need to recognize where you are in the journey too. And it's okay for it to be awful at times. I think you have to recognize that, but then you also have to look for your wins, whether they're little
Hmm.
tiny wins or big wins.
Hmm.
It's like, okay, like for me, it was like, wow, I was able to stand up for 10 minutes
Hmm.
um, because my sacrum was crumbled from,
Mm.
a lesion. So,
Wow.
I think having, reasonable expectations based on where you are. Like today, it's a good day for me when I've gone to Pilates and for a walk and played pickleball. That would not have been reasonable for me to say at other points. So it's knowing where you are and finding your wins wherever they are, but also, if you're having a bad day, it's okay to have a bad day. Um, and kind of let yourself be like, this is terrible. This stinks, and knowing who you can talk to when you feel like that,
Hmm.
but then also trying not to get down in the rabbit hole where you can never get yourself back out.
Right. Yeah, I remember when I was first diagnosed and I'm reading about it and I'm going, oh my God, I'm going to die soon. And I talked to my friend who was a long-term ovarian cancer survivor. Said, Michelle, stop looking at those numbers. And um, if you have to have a pity party, give yourself 5 minutes to have a pity party and then move on. And that was helpful.
I like that. Anything else with maintaining normalcy or balance? Is there anything else there?
Well,
Got
I've
some
kind
great
of
suggestions.
embraced. I embraced being part-time work, and I I did lunch really well with friends, which I wasn't able to do when you work full-time. So I was
Yeah.
good at doing lunch. So, those little things every day. And I
Hmm.
find that um, if I want to do something, I pretty much do it, let the housework go and pick up the phone and, those things that
Hmm.
matter.
Right.
I love that. Thank you so much. Um, so we're just going to jump into the next question, which is just looking at support. So, what role has community support groups or connecting with other patients played in your journey?
Hmm.
We'll go
I'll
ahead
go.
and
I'll
I live
go.
in a, go ahead,
perfect.
Cindy.
Go ahead.
Go ahead, Pauline. You can start.
No, 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 I live in a really small town, and so word gets out, and isn't that, like so and so's diagnosed? Isn't that what you had? And I've lived here all my life. We're a really small town, so to be able to reach out and just put the ball in their court, not overdo it and overshare, but that has been really good. A lot of give and take on, I learned from the other patients, just like our coaching too.
Hmm.
You learn from them right
That's
along
true.
with them learning from you. You got to get out of your own head sometimes.
Hmm.
I think having that opportunity to connect with people and share experiences, but then also share how you've navigated different things. That's wonderful. Thank you.
Hmm.
Do you want to go ahead, Cindy?
Yeah. So, I think connecting with patients through various means has been extraordinarily helpful. When I was first diagnosed, I went to a couple support group meetings and honestly did not find them to be particularly helpful. I was younger than everybody else by at least 25 years. And I thought they were kind of depressing.
Hmm.
Actually, there wasn't a lot of hope and optimism. Um, we, within my community, we've kind of informally formed some support groups that, are not connected to any organization or anything, but we have a tremendous level of support for each other and do things socially together and talk to each other and use as resources. I've met a lot of patients at City of Hope that, because you're kind of clustered together when you're there, certainly in waiting areas and things like that. So met other patients that way. A phenomenal network through HealthTree. Even, obviously as a coach, we're all um, connected. And then, I would say at least once every 2 weeks, I have some person in my life reach out with someone they know who's been diagnosed. And
Hmm.
just yesterday, I spoke for a couple hours to a lady who was the sister of a friend, who had recently been
Hmm.
diagnosed. So there's a lot of, I think, sharing your story in an encouraging way kind of makes other people, whether it's through social media or something, they're like, oh, I think that's what, Cindy Brown has.
Hmm.
And you get connected that way has kind of created this network. So I have this, even people I'm coaching, I would consider part of my support group.
I
Yeah,
love
I
that.
agree
Thank
with
you
a
so
lot of
much.
what Cindy said too. When I first went to a support group, like you, I found it a little depressing, and um, I found that actually I was spending a lot of time coaching the other people in the group, and I thought, well, I'm not really getting a lot out of this. Um, and I haven't really made a lot of connections with people that have myeloma other than through the coaching, which has been wonderful, and doing the same thing that Cindy did. I've always said to people, people will tell me, "Oh, my friend was diagnosed with myeloma. Do you think you talk to them?" And I said, "Sure." And I've always made myself available to other people who are facing a new diagnosis, and I find that very rewarding. And I think it keeps me on track, as far as feeling positive about myself and hopefully helping other people feel positive.
I like that. Um, I like that you mentioned, I think we've heard coach a couple of times. I'm going to put this in our follow-up email. I always like to assume everybody in our community has heard of coach, but if you haven't heard of coach, it's an opportunity if you have had myeloma for, a couple of years and want to share that experience with somebody else, you get that opportunity. And then on the flip side, it doesn't have to be a specific number of years. If you need help and you just want to speak to somebody, and I think these three ladies could probably say a lot more about it than I can, but it's a wonderful program. So, anyone want to add anything to that?
I think the program is great, and also as a coach, to be in a good place, to be able to
Hmm.
help somebody else, and to listen to yourself. I mean, if there's a time where you're like, "Yep, I need to back off a little bit," and because I can't read everything that comes down the pike either. Sometimes it's like, okay, I need a break from multiple myeloma, on a certain day. You just need a
Yeah.
break.
Yeah.
Right. All right. Thank you guys so much for all that. We're going to go on. This is our last question, and we'll open it up for a couple of questions as well. But I always like to wrap it up with if you could share one piece of advice with someone who's newly diagnosed, um, what would it be? Go
I,
ahead.
yeah, so I think the single most important thing is to make sure that you are seeing a multiple myeloma specialist. The landscape, the treatment landscape is changing so rapidly
Hmm.
that it is impossible for even the very best community-based oncologist to be up on everything. And seeing a myeloma specialist does not mean that you have to live where one is or be able to travel to one once a month. You can have your consult, get a plan, and your community-based oncologist can carry through the plan, and the myeloma specialist can be someone that you see quarterly or twice a year or whatever you need. But you always want to have someone who is tuned into everything that's going on treatment wise because the options are greater. And it's well documented that people who see a specialist have better outcomes.
Hmm.
So that would be the single most important thing, I think.
Great. Thank you.
It's
How
hard
about
for
you?
me to pick just a single thing, but I think my summary of that would be hopeful, be active, and be informed. I think that's really important in terms of being able to know what different options are and bring things up to your doctor. And like Cindy said, going to a myeloma specialist, absolutely so important.
Yeah, and to go in, like we stated before, with your questions and an
Hmm.
open mind, and uh, be a compliant patient. You know, um, it's hard. I like being in charge, and sometimes it's hard.
Hmm.
I think too, and we've sort of touched on this, you have to be your own advocate.
Yes.
So not only do you have your questions, but to the extent that you are comfortable understanding what's going on medically and your options, fight for what you think is best for you.
Hmm.
Obviously recognize, the doctor's expertise, but you need to communicate and you need to make sure that you're getting what you need from your care team.
Absolutely. I've said it before, I'm a nurse. You would think I would be really good at advocating for myself, but it is a learned skill. Um, is there any resources or anything like what did you do, Cindy, to help you feel more comfortable speaking up and speaking to your doctor?
So my previous career was in the medical field, on the business side of things, but I was always working with a lot of doctors. So I'll be honest, I was not intimidated by doctors, so it's not hard for me to talk to them. But this comes up, I would say, in the vast majority of my coaching, that people are uncomfortable, and so I always encourage them to take someone with them
Hmm.
that understands the questions and is comfortable asking them, because some people get emotional and it's a little bit harder. Have your questions written down makes it a lot easier to do it. And, if you feel, I always tell people too, if you feel like your doctor rushes you or doesn't have time, to send your list of questions and concerns ahead of time, and hopefully
Mhm.
they'll have a chance to look at them so that you can best use the time that you have with the doctor. But having
Right.
someone with you, if you're not comfortable doing it yourself, makes a big difference.
My
I would
husband
agree.
was that. My husband was the devil's advocate. He's real soft spoken, but he can he can do that one.
I love it. Michelle, did you want to say something as well, or?
No, I agree with what Cindy said. You do need to learn to become your own advocate and speak up. Fortunately, my doctor is very receptive to that. Um, and like I said, my husband got until his stroke, he went with me to every single visit. And in fact, it's an interesting thing. When I had breast cancer, my doctor made a tape, an audio tape of our session because he said, "You're not going to hear everything today. And this way you can go back and listen and, better understand the situation." So when I was diagnosed with myeloma, we actually got a recorder and we took it with us to all of our appointments. And it was very helpful because sometimes my husband and I would disagree over what we heard, and we'd go back and listen to it. And it's just another thing I found very helpful.
Like that. So having a recorder, having somebody on your side, Pauline, I
Hmm.
loved. It's hard. Certain personalities maybe are a little bit more soft-spoken, but that's wonderful that he was able to stand up in that position.
Hmm.
So
Right.
wonderful. Well, we have had some great discussion here, and we've got some discussion happening in the chat as well. So I just want to open it up if everybody's comfortable. I'm going to close these slides just so that we can see everybody just a little bit more clearly. There we go. But yeah, if you guys have any questions for our panel, um, this would be your opportunity to ask those questions. I will try to get through some of them that are in the chat as well. Bear with me just 1 second. Let's see. Okay, there we go. All right, Tony, do you want to unmute and ask your question?
Yes, Cindy, what treatments are you having every 3 months?
It is teclistamab or Tecvayli,
Hmm.
which is one of the bispecifics. I started in a phase 1 clinical trial in March of 2020, and it was, in my case, which is different than now, it was once a week for a year, then every other week for 2 years, and then every 3 weeks for a year. And then I went monthly, every other month, and to quarterly. That transition was all over 1 year.
Hmm.
And you in full remission, right?
I am. I
Oh,
am.
okay. Congratulations.
Thank you. Thank you.
It's amazing. Thank you. Donna, if you want to unmute, you can ask your question.
Sure. I'm just wondering, some of the long-term survivors I'm only diagnosed, it's coming on 2 years. I quickly had gone into remission, then came out, and now I'm on a bispecific. I'm just wondering, the long-term survivors, when you were first diagnosed, was anybody diagnosed as a very aggressive form?
Now, I was lucky that I didn't have a very aggressive form.
Let's
I
see,
don't.
Cindy or Pauline,
Yeah,
did either of you?
so Donna, that's a good question. I was called at the time functionally high risk, so not high risk genetics, but I had a very poor response to RVD. So ended up having to do VTD PACE, and that's why I did a tandem auto allo transplant at the beginning. Um, so, but not aggressive in terms of the genetic abnormalities.
Mm.
Right. That actually came up in the chat as well, just wondering if there's any long-term survivors with more aggressive forms. So thank you for answering that. Um, we had, let's see, if you want to ask a question, you can hit the raise the hand icon down at the bottom. I'm going to try to get through the chat, but it's active with people talking back and forth as well. We did have somebody asking about sleep issues. Tom, if you want to be up after Howard, I will start with Howard and then we'll move over to Tom. Go ahead,
Thank
Howard.
you. Thank you, and congratulations to everybody. I think it was Michelle who said she had 4 stem cell transplants. Did I hear that
No, no,
correctly?
no, no. I only had one stem cell transfer. I think Cynthia, you had,
Oh,
I had
well, I don't
two.
know, actually, two, right?
what were those like for you? And how did you, any tips for preparing and surviving it?
Are you getting ready to go through a stem cell transplant?
Well, I'm calling on behalf of my wife.
Oh,
It's not imminent, but it's possibly on the horizon.
it's the the is lo sorry, I'm tying up my thoughts. Um, the stem cell transplant is for many people not a walk in the park. It's the chemo that you have leading into stem cell transplant is unpleasant, I will say. Um, they're really good at managing the nausea and associated GI side effects that come with
Mhm.
it. There are a lot of people, certainly now, I get my treatment at City of Hope, and I've coach a lot of people all over the country that have done their entire transplant outpatient, which is awesome. Um, it that depends a little bit on the person and sometimes on the insurance. After you go through transplant, every day is a little bit better than the day before. You need
Mhm.
to find some foods that taste good. Don't worry about the nutritional value. I lived on mango smoothies for a month because that was the only thing I could
Yeah,
taste going down that was remotely tolerable. Um, but just, and to like we kept, I don't want to be a broken record, but if you can move, move. Don't just lay in
hmm,
bed and feel awful, even if
yeah,
it's, one lap around your house or one lap on the hospital floor, do it.
yeah. Well, stem cell transplant was something I was fortunate enough to postpone for 9 years. Um, my response to thalidomide and to Revlimid and to some other treatments was very good. And my doctor had said to me, you know, there's no rule that you have to do a transplant at any particular point. And I did, I guess maybe it was about my second or third remission. Um, he looked at me and he said, I think it might be time, Michelle. And at that point, I just, adjusted to that. I thought, okay, this is something I have to do. I will do it. I'm not going to, you know, I read the side effects, but then I handed them over to my husband and said, "You're in charge of this. I'm not going to dwell on these things." And and I did try every day to just go a little further. We rented an apartment near the Moffitt Cancer Center, and we would go out and walk. And at the beginning, because your counts are down so low, you have no energy, you're short of breath. At the beginning, if I could walk, 20 or 30 steps, okay. Now tomorrow I'm going to walk 40 steps. And that was kind of how I coped with it. But I was fortunate that I didn't have a lot of side effects that some people have had with stem cell. But I also think that they have improved it so much over the years. People used to get very sick, and they don't now because they give you drugs to help prevent some of those side effects.
Howard, I don't know, physically how your wife is at this point, but my suggestion is go in with a plan.
Hmm.
Like go in with how you're going to address things physically. mentally, spiritually, have a plan,
Mhm.
what works for her. Whatever that looks like, go in with a plan.
I like that. I was
Yeah.
also going to mention we have a stem cell transplant guide, Howard. I will put that in the follow-up email, but you can look for it on our website as well if if you're needing it sooner than it gets to you, but I'll make sure we send that out as well.
Thank
I
you.
did say, yes, of course, thank you. I said we go with Tom, and then I've got three more questions. I've got William, Marva, and Michelle. So we're going to take those four, and then I think we're probably going to be out of time for the rest of the questions. But Tom, if you want to unmute, we'll start with you and then go down that line.
Um, so first of all, I want to thank each of you for sharing your story. It's been very helpful for me to hear other people's experience. So thanks for that. Um, Also, it makes me think I'm pretty lucky. So thanks for that too. Um, I got diagnosed 5 years ago. I had a stem cell. I'm coming up on 1 year in January. I got through it. There were difficult times. I'm fortunate that I can still exercise, I can still work, so I feel good about that. But one thing I have that nobody mentioned is I have a lot of difficulty with sleep disruption.
Mhm.
I mean, I go to sleep like terribly early and then I wake up in 2 or 3 hours like it's the
Mhm.
morning and it's hard to get back to sleep
Yeah.
and then there's anxiety because oh God, I'm not sleeping and what's going on tomorrow? Do I have to be conscious and awake? And I they offered sleep drugs. I don't want to try those. I look at every drug as a new opportunity for a new side effect. And I'm just wondering, and I do all the standard things, that people post about how to improve your
Mhm.
sleep. Like you have a ceremony before you go to sleep, you reduce screen time at night, you eat smaller dinners. But I'm just wondering what other people's experience has been, and have you tried anything that works? Thanks.
Tom, I have a couple suggestions. One is I still have one of those old iPods. I keep it under my pillow, and when I'm having trouble going back to sleep, I just put on some relaxing music, and I won't even turn it off. I'll just listen to it till I fall asleep. Um, Another strategy. Oh, and I've also taken over-the-counter things. Right now, I actually am taking something, the name of it. I'll think of it. Anyway, it's basically an antihistamine. And I have no side effects from it at all. It's called Unisom, Unisom. Um, and my doctors have said, it's fine to take it. And if you don't have any side effects, just don't worry about it. Um, I think that's all I can really think of at the moment.
Tom, I would say I have similar experiences at times. Um, and have tried the traditional things, like you said, smaller meals, no caffeine afternoon, all those sorts of things. Um, I kind of have a rule that if I'm awake and having not and feeling restless for more than 15 minutes, that I will read a little bit because that tends to help me fall back to sleep. Um, I have a prescription. Are we allowed to say, Cindy, if we something we take?
Well,
I
I think with the caveat that Michelle said, so just, of
okay.
course, any
So
recommendations, make sure you check in
Right.
with your doctor.
yeah,
So
Right.
that's
yeah.
perfect.
I have a prescription for Ativan, which is
Mm-hmm.
technically an anxiety medication.
Yep.
That I initially took for nausea, actually related to my transplants.
Mm-hmm.
And if I have two bad nights in a row, I'll take one of those the next night and I sleep great and have no residual hangover. The sleep medications I
Mm-hmm.
find make you very, very groggy the next day.
Mm-hmm.
Okay, thanks.
Thank you. All right, I'm going to start with William and we'll go on from there. William, if you want to unmute.
Yes, hello everybody, and thank you so
Bye.
much, ladies. It was very interesting. Um, And I just wanted to say I'm a 16-year survivor, and I've had 5
Congrats.
lines of treatment. And to hear the ladies speak about their experience in such kind, warm words, it's very nice. And I wonder how the men have experienced, how they've handled their emotions, how they've handled their relationships.
Hmm.
What has been their experience? Would have been so nice to hear about, a man as well. How does he experience it? But I would just want to say everything you said, I had, I share really every single item. So that we
Uh,
do share a lot in common.
Yeah.
Good.
Absolutely. I was
Yeah.
going to say this is something that came up early after I had asked the three to join, and Cindy brought it up, and she said, it would be really good if we had a man. So I am definitely going to balance my panels out a lot better next time. So thank you for that. I appreciate it. There you go. Um, all right. With it just being this panel, we'll get some more perspective next time. Marva, if you want to unmute.
Okay. Hi, I am Marva Adams. I'm a support group leader in Charlotte, North Carolina, 26 and a half year survivor. And
Wow.
I wanted to
Yay.
mention thank you. I mentioned the neuropathy. I have been drinking something called noni juice since 2003. I was taking 90 pills a month for neuropathy.
Oh.
I did the VAD before the very next year they started doing thalidomide, and I did that too and got horrible neuropathy, did a Velcade study. The neuropathy was awful.
Oh,
I
yeah.
was like, I can't live like this. And that noni juice I've been drinking since then, 2 ounces a day, never taken another drug for neuropathy, even though I've been on
Hmm.
Revlimid, I've done study drugs, I've done different things. And also barley grass. I've been drinking that for over 23 years to detoxify my system, build healthy cells. I'm really leaning into the natural stuff, oregano oil, liposomal vitamins. But there's a site called Hallelujah Acres. My mom took me to this place years ago, and I heard a lecture, 10 steps for healthy living, even sitting in
Uh-huh.
sunshine for 15 minutes a day. But I make smoothies every day with like 4 or 5 vegetables. I use Ceylon cinnamon that balances blood sugar. It's a great cinnamon is very high in antioxidants. And then the other half fruit, and I'll do some coconut milk water and some pea protein, and it tastes like a milkshake.
Hmm.
But that's I'm do that faithfully, and then up the barley, collagen peptides, and some other things, flaxseed. I mean, I do a lot of that, and I mean, I've been faithful with that regimen for a long time. And my doctor says my numbers are better than he's seen all week every time he sees me, and they're better than they
That's
were
great.
prior to myeloma. So it's great.
Yeah, so important
And we got a
to
great
look
support group too in
for
Charlotte.
good support. Yes, exactly. And
Yeah.
Yeah,
um,
I've been a leader for about 7 years, I think. But yeah,
Can
12
I
perfect.
is
Well,
a
just
thank
12
you.
year old group.
can I just ask what's noni juice?
It is a fruit that grows year round, either in Tahiti or Hawaii. They call
Okay.
it the vomit fruit, but it really doesn't taste that bad. It's they mix it with cherry juice. It kind of tastes kind of like prune juice a little bit. Doesn't taste bad at all.
I love it. Well,
Better than
thank you
barley
so
grass.
much.
You're welcome.
Thank you, Barbara. And just as with everything else we've talked about, just of course, make sure you're running anything new by your physician. But I'm sure that's,
Mm-hmm.
Oh, he knows.
sounds like
Dr.
you're
Voorhees knows it
already
all. He knows all about
perfect.
my regimen.
Right.
Beautiful. All right. Thank you. Michelle, would you like to go ahead and ask your question?
Yeah, I just had a question, like what were the gaps between anybody's relapses? Like were they 5 years? Were they 10 years? Were they,
I
and
had a
relapses?
I did the 3 treatment regimen, VRD, and then stem cell transplant. And then I had 5 years till I relapsed. And three of those were med free, treatment free.
Okay.
Wow.
5 years after my first transplant. And then my second transplant, I got about 2 years out of that and then
Hmm.
relapsed. So,
Yeah, because I had been told that like I mean, I don't know when that all happened, but I was told like they're no longer doing stem cell and then stem cell because they haven't found that stem cell actually the second one doesn't really kind of give you the oomph that you kind of need.
Hmm.
well,
So,
there is such a thing as the tandem stem cell transplant, right? I didn't have that. Like,
Oh, like back to back?
do those
Yeah.
back to back.
Yeah, and I don't know if they were thinking about doing that with me, and then they said no, and so now I'm in not a real relapse. My numbers are kind of going kind of bad, but I guess they're now focusing on which I heard from this, international multiple myeloma, that there's clinical trials of people that are on the upswing with the MRD, that they're trying to find out why people are on the upswing before it actually gets bad.
Mhm.
So they're trying to like nip it in the bud and figure out why that is even happening. So that it's good news. Like you said, I think everybody here mentioned there's just so much going on, even when I had smoldering cancer in 2020 and then full blown in 2022. So every year or two, it's like you just don't even know what's going on.
Yeah.
Right.
Yeah.
Michelle,
There's,
Way, you don't know what's going on in a good way.
yeah.
yes.
Michelle, I would say that, the relapse times varies dramatically from person to person. It's really, I mean, I always
Mhm.
tell people when I'm talking to them, we're all a data set of one in
Oh, yeah.
myeloma because, maybe you found a myeloma twin on HealthTree, but lots of people do not have a myeloma twin. So I think it's just staying on top of it and um, being in communication with your doctor. My
Right.
early relapses came, pretty quick, kind of on top of each other. But I'm almost 6 years on teclistamab now
Okay.
with you know
That's
perfect
fantastic.
myeloma numbers. I wouldn't say perfect numbers, but perfect myeloma numbers.
Yeah. No, 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 I know. And I'm one of the rare people that like there was many things you had to go to get your stem cells that took one day, and like my stem cell transplant actually was just 4 bad days, and other than that it was fine. So I'm like I have some like abnormal, not abnormal, but like you really can't with multiple myeloma. There's no people can tell you what they've experienced, but it means
Hmm.
nothing. Because it
That's
doesn't
No,
mean,
right.
it's not apples to apples.
and
Yeah.
somebody else I know just got
Right.
diagnosed recently, and they were asking me some questions, and I'm like, you kind of just have to like learn to kind of, I don't want to say let it go because that's the wrong word, but take it in and then
Mhm.
kind of go with it.
Mhm.
And I don't know what to
Right.
tell you. If you have no patience, you better get some quick. That's all I got to tell you.
That's right.
Agreed. Well,
Thank you,
thank you
everybody. I greatly
guys.
appreciate everything.
And thank you for asking your question. Grateful to have everybody here today and wanted to thank our panel again. It was amazing to hear from all of you, hear about your experience. We did add up our numbers, and we have in this group of the people who responded 504 years and 5 months of survivorship. So that is remarkable.
Yay.
And we had one patient with 28 years, and then we heard from Marva of
Wow.
26.5 years. So, congratulations, everyone. And I think it's amazing just to see the strength that everybody here has. So, thank you for sharing that. Perfect.
Thank you.
Thank you.
Thank you for organizing this.
Thank you, Cindy.
Of course. Thank you. And we will just go ahead and close out with the rest of our meeting. So, I just wanted to bring up some of our upcoming events, so you know what we have up and coming. If you are in or around Memphis, today at 5:30 p.m., we have a Discover Cure Hub with the Memphis IMF support group. Also, if you have a support group that wants to hear more about Cure Hub and would like to have us join, just send me an email and I will make those connections for you. Um, we also have on Thursday the 20th, our Black Myeloma Health Group will be meeting at 2 p.m. Eastern to hear from Kim Burney, who will lead a discussion around partnering for better care strategies for shared decision making. And then this Saturday, the 22nd, if you are in or around Spokane, you can come join me at the Connect Cures event. I'll be emceeing that one, and I'd love to meet anybody who is on this call today. We've got the ability to register for these and many more events at healthtree.org. I'll also send that in the follow-up email. I'd like to again thank our sponsors, Adaptive, Pfizer, Johnson & Johnson, Amgen, and GSK. And as you leave again, we'd love to hear from you. Let us know what you would like to hear about and how we can support you. Lastly, I've got my email address up there on the screen. If you do have any questions or if there's anything I can help you with, please don't hesitate to reach out. I do love hearing from you, and I hope to see you all at another meeting again soon.